Hi everyone. So today we're going to be looking at a question involving lipids and the cardiovascular health. Okay, so we're going to do this scenario question and answer the follow-up questions. I hope it will be helpful and easier to understand after this video. So the question reads, a 58-year-old man with a history of a high-fat diet, smoking, and hypertension visits his doctor complaining of chest pain, angina. Diagnostic tests reveal significant narrowing of his coronary artery. What is the name of the disease process characterized by the buildup of fatty plaques in the arteries? Okay, so if we look at this patient is having has presented with narrowing of the coronary arteries. Okay, and there is a build up of fatty plaques along these arteries. So this is a typical case of atherosclerosis. Okay, so atherosclerosis is a condition where there is these lipid plaques are they stick to the walls of the arteries and cause the arteries to narrow up and harden. Okay, so this compromises the blood supply to the artery that has been involved. So, for example, the coronary arteries here are the ones that have been affected, and they are supplying blood to the heart. So, no wonder you are seeing that this patient is having chest pain because of there is probably ischemia that is happening in this patient. Okay, so the correct answer here is atherosclerosis. Okay, and then question B reads, what type of lipid is a major component of these artery plaques? Okay, what type of lipid is a major component of these artery plaques? So the major lipid component is mostly cholesterol. Okay, so cholesterol is the bad type of lipid that mostly is involved with plaques, forming plaques along the arteries. Okay, so especially the low density lipoprotein cholesterol, it is the one that we do not, that really is not compatible with life. Let's say that. Okay, so for question B, it is cholesterol, low density lipoprotein cholesterol, especially. And then we go to question C, differentiate between saturated and unsaturated fats. Okay, so to differentiate between saturated and unsaturated fats, you find that the difference is mainly in their double bond. Okay, so in the double bond, like when it comes to the double bond, for saturated fatty acids, they have no double bond between the carbon atoms. So usually they are solids at room temperature. Okay. And an example of a saturated fatty acid is butter or animal fats. So those are saturated fatty acids. Then we have unsaturated fatty acids. Such unsaturated fatty acid have one or more double bonds in their structure. So these are usually liquids at room temperature, and examples are oils such as the olive oil and vegetable oils. Okay, so these are some of the differences and examples of the saturated and unsaturated fatty acids. Okay. Okay, so it's the same question that is reading. So the next question reads, explain how the narrowing of the coronary artery can lead to myocardial infarction, which is a heart attack. So when you talk about narrowing of the narrowing that leads to myocardial infarction, so firstly, there is narrowing of the coronary arteries that eventually leads to reduced blood flow. Okay. So this narrowing of the coronary arteries will lead to reduced blood flow and oxygen supply to the heart muscles, the myocardium. Okay. And then because this narrowing is happening or it's occurring due to the plaques that are accumulating. If one of those plaques ruptures, so it can trigger a blood clot. Okay, it can trigger a blood clot or formation of a thrombus that can completely block the artery. Okay, so when it completely blocks the artery, it will eventually lead to blood not going to the myocardium. Hence, it will lead to ischemia. And then this ischemia will also be accompanied by prolonged lack of oxygen. Okay, so that prolonged lack of oxygen will lead to eventually death of the heart muscles. Okay, the heart muscles, when they die, this is eventually going to now lead to myocardial infarction. Okay, to this infarction that's happening. Okay, another disease associated with abnormal lipid accumulation is fatty liver disease. Another disease associated with abnormal lipid accumulation is fatty liver disease. Which organelle in the liver cells would be most directly involved in processing and metabolizing these excess lipids? So you find that the organelle that is involved in lipid metabolism is the smooth endoplasmic reticulum. So it plays a key role in lipid synthesis and metabolism in liver cells. Okay, so it is the smooth endoplasmic reticulum. If a blood clot forms in one of these narrowed arteries and travels to the brain, it can cause a stroke. What is a specific term of this type of stroke? Okay, so the type of stroke that can be caused by this traveling clot can be either, okay, so stroke can be in two forms. We can have an ischemic stroke or hemorrhagic stroke. So mostly ischemic type of strokes are caused by blockage in the arteries. So you find that there's something blocking the arteries that will eventually lead to ischemia in part of the brain and eventually cause a stroke. So those type of strokes are called ischemic strokes. Then we have the hemorrhagic stroke, where it is caused by bleeding or hemorrhage, rupture of a blood vessel that eventually leads to compromise in blood supply and leading to a stroke. So following this explanation, you'll see that a blood clot that forms in a narrowed artery and travels to the brain, causing a blockage, will eventually lead to a stroke. It's called a specific term that we can call this is ischemic stroke. And specifically a subtype known as embolic stroke. So embolic stroke, this occurs when a clot or an embolus travels from another part of the body to the brain and blocks a cerebral artery. So this is about this question. I hope the question was helpful. So if you want to access more of this paper, so there's this paper has been uploaded on the drive, and there's a full video explaining most of the questions like this. Okay, so feel free to subscribe to our drive, our institute, which is Learning District Institute.